those of you who have done your ACL, this is for you. My 12-month recovery process, a long-awaited video. My 12 months, I'm going to talk you through each month, what to expect, and to remind you that you will get better. My ACL process began in January 2019, and bang, pop, hit the ground. I knew it was bad straight away. I didn't know what it was. I knew my knee, something had exploded in my knee, but I didn't know what it was. Got a fright, and that was mid-January. By the end of January 2019, I'd seen a specialist, I'd had my scans, MRI scan, and it was confirmed it was a full rupture of the ACL with a little bit of meniscus damage. By mid-February, I wasn't actually in much pain. I was kind of hopping about. I managed to take a week holiday, and considering the severity of the injury, I don't think there's too much pain associated with it. The way I damaged it, there wasn't too much pain anyway. 21st of February 2019, surgery day, I got the patella tendon graft, which is basically taking a third of your patella tendon, which is the little tendon or the big tendon underneath your knee, rather than the hamstring. My surgeon opted for that because I was playing professional football. He also believed that patella tendon graft is bone to bone, so it's stronger. And also by the 21st of February 2019, I'd spent just around 4 or 5 weeks researching like mad. I knew exactly what I was going to do when I woke up from that surgery and kickstart my recovery. But I also knew I was going to be getting physiotherapy from Dundee United because that was the football club I was playing for at the time. After my surgery, I basically just was doing very basic movements. I was doing quad tenses, I was doing little flexion and extension exercises. I was using loads of ice. If you can access a game ready, get one. It's a sleeve, you wrap it around the knee, it compresses and pumps cold air or ice cold water onto the knee, which was unbelievable for me. It passed a lot of time because you're kind of bored, but it also helped massively reduce the swelling in my knee. And during this 4 to 6 weeks, there's lots of swelling, there's lots of bleeding, there's lots of pain. It's not very nice the first 4 to 6 weeks. As we enter March, one month post-op, I get the staples removed, all my dressings off, but I'm still moving around in crutches. I was on crutches for 6 weeks, and by the end of March, I was back in the gym, starting to do a little bit of work, and as you can see, there was a lot of muscle wastage. And by May, 3 months in, I was walking about fairly well. I'd reintroduced resistance training, very light, and in a small range of movement. We were then into June, 4 months in, started doing a bit of running mechanics before I went onto the pitch to run. I was doing bike CV to keep my cardio up, and I was starting to add in a lot more resistance training for my lower body. Then we hit the 22nd of July, a monumental day for Sam. I was 5 months post-op, and it was my first day running. Unfortunately, as you'll be able to see in this video, I was not running comfortably. I was in quite a bit of pain, combination of tendinitis from the tendon graft. Also, I was having issues. So I developed thickening of the joint, so basically scar tissue hardens, and this resulted in me getting a second operation. Not to fix or do anything with the graft, just to shave a little bit of the thickening of the joint away because it was catching, it was causing a little bit of discomfort. The minute I woke up from anaesthetic, the minute I woke up in that hospital bed, I did that, and I knew straight away, I was like, this is it, I'm ready, I'm fixed, let's go. This is it this time round, I feel good. And through September, October, November, I just ramped everything up. I started changing direction, I started running, I started sprinting, jumping, I was lifting insanely good weights in the gym. I'd got all my muscle back, both legs were the same. I did the Bidex machine, which is that torture seat you've seen Roy Keane in before. All my scores were perfect. And I have to put that down to, of course, myself following my programme consistently, but my physio at Dundee United, a man called Marcin, he not only understood the difficulties I would face physically, but also mentally, and he gave me some days off. He told me sometimes, Sam, you're doing too much, go home, take this week off, forget about things. And that really helped me. As a young player, at the age of 20, 21, you need that guidance. And by December, I was getting close to my return to football. I was still getting a little bit of tendon pain. I was doing a lot of eccentric movements. I was doing a lot of quad tenses. I'd got these little patches that were increasing blood flow to the tendon to help reduce that pain. And then on the 14th of January 2020, I returned to football. Fit as a fiddle, my knee, strong as ever. And 4 years later, do I get issues? Not really. Occasionally a little bit of stiffness in the knee, but it's strong. I feel as good as I did before I got the surgery and the injury. So you can recover. You just have to be patient. Don't rush back. I took 11 to 12 months. If you return anything before 9 months, I think it's too early. You want to get that full rehab done, 9 to 12 months.